You may be wondering, what are the new provisions to the Health Professions Act? An act to protect patients? And what do these new HPA provisions mean for the profession of psychology? Let's start with the basics. The psychology profession already has a strong framework for the protection of patients. It consists of 4 ethical principles. Number 1, respect for the dignity and autonomy of persons and peoples. Number 2, responsible caring. Number 3, integrity in relationships. And number 4, responsibility to society. The new provisions to the HPA outline specific consequences for any regulated healthcare providers engaging in sexual abuse or misconduct. The HPA defines sexual abuse as sexual abuse means the threatened, attempted, or actual conduct of a regulated member towards a patient that is of a sexual nature and includes any of the following conduct: sexual intercourse between a patient and regulated member, genital to genital, genital to anal, oral to genital, or oral to anal contact between a regulated member and a patient, masturbation of a regulated member by or in the presence of a patient, masturbation of a regulated member's patient, encouraging a regulated member's patient to masturbate, touching of a sexual nature of a patient's genitals, anus, breasts, or buttocks by a regulated member. HPA's definition of sexual misconduct is any incident or repeated incidents of objectionable or unwelcome conduct, behavior, or remarks of a sexual nature by a regulated member towards a patient. Remarks that the regulated member knows or ought reasonably to know would cause offense or humiliation to the patient, or adversely affect the patient's health and well-being, but do not include sexual abuse, are also included in the category of sexual misconduct. The regulated member knows or ought to know that these types of behaviors and remarks are inappropriate for any health professional. A member convicted of sexual abuse permanently loses their professional practice permit. If the hearing tribunal makes a finding based on allegation of sexual abuse, the hearing tribunal must order cancellation of the investigated person's registration and practice permit. Note that the sanctioned member is not permitted to reapply to the College of Psychologists. Furthermore, the College of Alberta Psychologists has a duty to inform governing bodies of any similar professions across provinces and territories of the finding. If the hearing tribunal makes a finding based on sexual misconduct, the hearing tribunal, number 1, must order a suspension, using their discretion as to the length of the suspension, and number 2, is prohibited from imposing gender-based conditions. For example, cannot order chaperone to be present when treating female patients. Consequences to the client, psychology profession, and practitioner in the event of sexual misconduct or abuse are serious.